Good morning to you. My name is Patrick Kingsley. I'm going to talk to you about some interesting things which, as far as I'm concerned, are in this book. I'm actually going to speak and put up slides, so you don't need to take notes if you don't want to. It's all in the book. You can get a copy of the book afterwards if you want to. When I was a medical student, I learned anatomy and physiology. I understood what that was all about. And when I went into the wards to deal with patients, I was shown how to make a diagnosis and then how to treat the patient, either with surgical operation to remove the offending structure or to drug it into submission. And I was waiting for somebody to say, and we're going to show you how to return people to normal. But it wasn't anywhere in the syllabus at all. Nobody showed us how to return people to normal. And so I learned what I had to learn, because that's what you're there for. When I then became a junior doctor in the hospital, people kept saying to me, why? Why do I have arthritis? Why do I have asthma? Why do I have cancer? And quite honestly, I didn't know the answer. That question kept haunting me all the time. Well, I was very busy working out in Barbados. I got one night's sleep in 4, that's a separate issue, so I didn't have time to work out why people were ill. But to me it was very important that I should learn that one day. And then after I'd worked as a junior doctor, I then worked in anaesthetics, and people did ask many questions about why when you're in anaesthetics, and then obstetrics and gynecology, and again, I think most people know why they got pregnant. So the reason why didn't come out too much. And then I joined a drug company for 8 years. So again, I wasn't in a position to find out why. But eventually, when I went into general practice and then set up my own practice, the question why kept coming up, and I had to find out. And basically, I think I know the answer to most people's illnesses now, and that's what I want to talk to you about. But it's primarily about cancer. Now, most people go to their doctor and say, "Doctor, I've got a problem. Would you please fix it for me?" That's perfectly normal. But what they should do, they should go to the doctor and say, "I have a problem. What can I do to help myself?" Nobody asks that question, or people are beginning to do so, but that's what they should do. They should ask, what should I do to help myself? And many people are happy with what the doctor recommends. It's the way to do things. It's the modern way. It's scientific. You have a problem, your doctor knows how to solve it. It's logical, isn't it? Your doctor knows which drugs are needed for certain problems, because a drug company has done the studies and said it works that way. I'm sorry, that is absolute nonsense. Only 19% of drugs out in the market actually do the things that they're supposed to do. So I'm afraid drug companies fiddle their studies time and time and time again to prove that their drugs work. But they have dreadful, dreadful side effects. Cancer. How and why it develops and what to do about it. That's what I'm going to talk about now, because I think I have the answer to most of the problems. The standard approach to cancer is cut, burn and poison. You all know about that. But what is missing, as I've already said, is why. Why did people develop cancer in the first instance? Why does cancer develop? It's important to understand that. Now, first, some facts about cancer. Cancer is a whole body condition. By the time a lump or something suggesting cancer has developed, it could have started 5, 10 or 15 years previously. People don't realise that. And I shall come back to that in a short while. It is multifactorial. There are many possible causes, some being more important than others. This approach is totally different from that by mainstream medicine. In mainstream medicine, they cut, they burn, they poison. They're not interested in why. If you have cancer in your left breast, they're only interested in your left breast. They're not interested in your right breast, your high blood pressure, your headaches or your constipation. And yet it's all important as far as I'm concerned. Yet everything links together. A breast is not simply a breast. It is linked to your hormones. You have estrogen receptors in every organ of your body, and that's what makes you a woman. So it's important to understand that. Medicine recognises certain causes of cancer. radiation and chemotherapy, smoking, asbestos, excess estrogen, human papillomavirus, Helicobacter pylori, acrylamide, benzene. They're all there. They're all understood. And if a woman is given radiotherapy for Hodgkin's disease in her late teens or early 20s, it is established she may well develop breast cancer later in life because the radiotherapy has caused the cancer. Yes, they may ask you to stop smoking. Fair enough. They may ask you. They won't tell you you've got to stop smoking, because unless you stop smoking, you'll never get rid of the lung cancer. We've got to get rid of your cancer, that's what they say. Got to get rid of it. And that's nonsense. You can get rid of it yourselves. But first let's look at what cancer is, how it develops, where things go wrong in the body, and what a cancerous lump is. It's generally recognized that chemotherapy and radiotherapy can kill cancer cells because they are rapidly dividing primitive cells. If a tumour the size of the lead sticking out of a pencil, you will have about 1 million cancer cells. That's a lot of cancer cells, but only about 1 million. If a tumour is 2 centimetres in size, you will have about 1 billion cancer cells in it. If your oncologist is lucky, he may kill 99.9% of your cancer cells, but 0.1% is still a lot of cancer cells, and they tend to be the more resistant ones. But they also damage your hair follicles, your intestines, your immune system, because the cells there also divide rapidly. And does anybody give you anything to improve your immune system? No, not at all. Mammograms also cause radiation. I used to say to a woman, if a man tells you to have a mammogram, tell him to put his bollocks in the machine first and see whether he likes it. It's absolute nonsense. It really is nonsense. And the point that I would say about mammograms, 5, 10 or 15 years ago when the cancer was probably developing, studies were done using thermoscans in comparison with the mammograms in America. And they decided that the thermoscan was giving false positive information. It was not giving false positive information. It was 10 years ahead of mammograms. It was actually picking up the beginnings of problems developing. So that suggests that cancer was developing at least 10 years before it became more obvious. Apart from damaging effects that mammograms have on the breast tissue, for goodness sake, if you've got a tumour there and they're squashing it, what damage is that going to cause to the cancer itself? It's really going to cause a lot of problems. In fact, there is a group of cells that grow even more rapidly than cancer cells, and that is the cells that form the afterbirth. Some of the cells, of the first few cells, form this trophoblast, and that attaches to the inner lining of your uterus and burrows into the wall and starts to grow blood vessels. That's what cancer cells do. So in this respect, trophoblast is similar to cancer. It is primitive, it's undifferentiated, that means it's not growing into the cells it's supposed to do, it's invasive, it's migratory, it's angiogenic, and the cells divide rapidly. And that's exactly how Dr. John Beard, an English embryologist, described cancer cells all that long time ago, around 1900. But the trophoblast cannot keep growing at the initial fast rate, or it will result in a chorionic adenocarcinoma. It's the most lethal type of cancer, and I have never ever seen such a case in my life. It's that rare. But at day 56, the newly developing fetal pancreas and the maternal pancreas combine forces and put out a huge output of digestive enzymes that slow this rapid cellular growth rate down to a normal rate. So digestive enzymes serve 3 purposes. They slow down the rate of the trophoblast. They help dissolve what I call a mucus protein coating that cancer cells surround themselves in, and they are anti-inflammatory. And although Dr. Beard suggested over 100 years ago that inflammation was involved in cancer, it is only now being recognized as such that cancer involves inflammation. He believed that the trophoblast sent out stem cells, which basically cells of the trophoblast, to every organ of the body with strict instructions how to behave, and that it was inflammation that caused these stem cells to cause cancer. I cannot grow a nose on the end of my finger. I cannot grow a finger on the end of my nose. The stem cells in my nose and my finger have got strict instructions how to develop into a nose or a finger, respectively. If the trophoblastic stem cells keep growing in an uncontrolled way because of the inflammation, they will remain undifferentiated. That means they have not changed into what they should do. They will grow too fast and will be of no value to the body because they do not function like normal cells. So a lump is formed of no value to the body, and that's quite simply what a cancerous lump is. It's a very simple, logical approach. So what causes the inflammation? This is where we're getting to the nub of the point. Basically anything that is bad for you. Life is bad for you. But don't forget that vitamin D is anti-inflammatory. Many of the top medical professors in the world are now beginning to recognize and for themselves have more than 10 times the recommended daily allowance of vitamin D. The recommended daily allowance is 400 international units. You need 4,000 as a proper anti-inflammatory. Where do you get the vitamin D from? The sunshine. When does the sun shine in this country? Not very often. If it's sun shining, what are you doing? You're in clothes, you're in a building, so you don't get the proper exposure to the sun. The sun, the vitamin D levels should be based upon Californian lifeguards, people in the sunshine all the time. The vast majority of people start off life with something inflammatory. Anybody know what I'm going to say? Cow's milk. Cow's milk is not suitable for the human being. It's made for cows to build a big animal with big horns and a little brain, not for human beings. And think about it, there's no creature on God's earth that has milk products after weaning, unless we give it to our pussycat. Otherwise, it is not for human beings. Then gradually a poor diet with comparatively low levels of nutrients in it, which your immune system needs. Your immune system needs it all the time. I haven't had an infection for years. I don't know when I last had an infection. Dairy products cause a lot of childhood infections. I was part of the audience of Dr. Harry Morrow Brown, the gentleman in Derby who set up the Midlands Asthma and Allergy Research Association. He's 95. He's still seeing patients. He said at the time that if you have a child failing to thrive, develops all sorts of problems like tonsillitis and adenoids, take it off milk products and it will stop getting them. And we all agreed in the audience, all knew that this was right. Animal milk products are not suitable for human beings. I used to see kids and I would say to them, your history sounds like a milk intolerance. They say, yeah, that's horrible stuff. So would you put on these cornflakes in the morning? Oh, I put it on that. So they hadn't learned from their own observations. And antibiotics are inevitable. Now, is there anybody in this room at all who has never in their whole life ever had an antibiotic? My golly, I'm the only person who's never had an antibiotic in his life. And neither has my wife. So that's 150 years of no antibiotics from two people. And it's for any so-called infection. Certainly the children will have the antibiotics just in case, even if it's a virus. Every woman knows that the antibiotics can cause thrush to develop. Why has thrush developed in your vagina when all you did was swallow the antibiotic? Think about it. The fungus must be throughout your intestines. You simply declare its presence in your vagina, and presumably somewhere along the whole length of your intestine, it just somehow gets outside. Dr. Tullio Simoncini is an Italian oncologist, and he's written a book entitled Cancer is a Fungus. Now, I don't know whether he's right or not, but he has written this book. And incidentally, he got thrown out of the medical profession in Italy for doing so. And to me, there is an interesting correlation between the rise in the incidence of cancer and the use, some people might say the abuse, of antibiotics. And sugar is the natural food for cancer cells. It is also the natural food for fungi. And I find that a very interesting observation. Suzanne Somers. Anybody heard of Suzanne Somers? She's a Hollywood starlet. She's a really healthy lady. She's put out all sorts of videos about health and exercise and diet. And she wrote this book called Knockout. She was diagnosed with whole body cancer by 7 oncologists. Who ever sees 7 oncologists? Well, not in this country. They may do in America. On scans. The most extensive cancer I have ever seen, the chief oncologist said of her. And she was offered whole body chemotherapy, but her daughter did not believe the doctor. So she said, you can't possibly have cancer. So she went home and wrote some books, and she told her all sorts of things, and it was decided when she was reviewed that she had valley fever instead. That's a form of fungal infection common in certain parts of America. So I wonder how many people have a fungal infection rather than the cancer. And what makes anybody think that chemotherapy will kill off a fungus? It doesn't make sense to me. So if that is the cause, what makes anyone think that chemotherapy will destroy the fungus? It's not logical as far as I'm concerned. Animal milks and products are inflammatory. Professor Jane Plant, in her book, Your Life in Your Hands, advises everyone with breast and prostate cancer to give up dairy products entirely. And I think that applies to absolutely every cancer, quite honestly. She went to China on a regular basis. She had cancer coming back 3 times. And she suddenly said to herself, what's the difference? When she was in China, she realized she had no milk products at all. So she stopped the milk back in England, and her cancer disappeared. Unfortunately, in her book, she has a number of recipes in the book, and she does recommend that you put a certain amount of sugar in some of them, so that's no mistake as far as I'm concerned. So avoiding sugar applies to all cancers, in my opinion. Free iron is also a natural food for cancer cells, so you don't want too much free iron floating around. Iron is normally carried in the bloodstream attached to proteins such as ferritin and transferrin. But free iron is inflammatory, once again inflammatory, and alcohol, which a lot of people drink, and excess estrogen release iron from these proteins. So don't drink alcohol. All chemical additives strip your body of essential minerals and vitamins, which lowers the effectiveness of your immune system. Most of what people eat produces an acid ash, such as grains, dairy products, meat and fish, sugar, cola-type drinks. That's perfectly normal. A lot of people do that. But the alkaline-forming foods are the foods that you can eat in an uncooked form. So fruits, vegetables, nuts, seeds, salad apples. There's a big, big difference between the two. Our bodies work best in a slightly alkaline environment with a pH of around 7.36. And for those of you that are mathematicians, this is a logarithmic scale. So a change from 7.36 to 7.3 is a huge difference, and you'll never get anywhere near that. If the pH is a bit lower than ideal, we don't absorb and utilize minerals as well as we should do. Normal cells thrive in a slightly alkaline environment, whilst cancer cells thrive in a relatively acid environment. A comparatively acid pH tends to lack oxygen. Cancer cells grow well in a low oxygen environment, as do fungi. There's plenty of oxygen at the correct pH of 7.36, and cancer cells cannot grow where there is oxygen. That's why exercise is good for someone with cancer, especially with oxygen. And I never understand why doctors say you don't need oxygen. They should give you oxygen to help you breathe it in, because you will absorb the oxygen more efficiently if you just step up and down stairs. You'll find the exercise improves your oxygenation. Infections are common in cancer patients, largely because their immune system is not very efficient. Professor Jerry Potti has identified salvastrols, chemicals fruit and vegetables naturally produce to protect themselves from fungal attack. There's the word fungus again. If fruits and vegetables are sprayed with antifungal chemicals, as they very often are, they don't produce salvastrols. And salvastrols are protective against cancers. Cancer tumours coat themselves in a mucous protein coating to hide from the immune system. If your immune system is not very good, it's too bad anyway, but you'll probably find the tumour will be hiding from your cancer cells, from your immune system. Oh dear, the emotions. Oh Lord, the emotions. I have never seen anyone with cancer who did not have a problem 5 or so years beforehand. Just about every patient I've ever seen has. Dr. Frieda explained that people develop cancer because their adrenal glands are exhausted by stress. Adrenal stress also stresses your immune system. So if it was low anyway, it goes lower. If you're affected by stress, you look after yourself. That is when your slowly growing tumour starts to grow faster and declares itself. You eat rubbish. You smoke more. You drink more alcohol at a time when your body needs more nutrients. People under stress tend to let their diet slip. They eat what is easy and convenient. Stress strips your body of nutrients at a time when you should increase your nutrient intake, but people don't. Stress makes your body become more acidic, as do chemotherapy and radiotherapy. But nobody tells you this. Nobody suggests that you should alkalinize your body when you have chemotherapy and radiotherapy. We produce free radicals every second of our lives. Most of us do not have enough antioxidants to quench those free radicals, largely because our diet is inadequate. Unfortunately, chemotherapy and radiotherapy produce also a lot of free radicals, and you're not given antioxidants to deal with them. They think that will stop their treatment from working. Exactly the opposite is the case. Your oncologist does not know the literature. There are about 180 papers published in peer-reviewed medical journals, many of which say that antioxidants with chemotherapy and radiotherapy improve the outcome. And I'm told that there are 1 or 2 doctors beginning to give intravenous vitamin C before and after chemotherapy, and they're finding it really makes a huge difference. Antioxidants attack cancer cells weakened by chemotherapy and radiotherapy and protect your normal cells. So if you're going to take antioxidants with your chemotherapy and radiotherapy, and I will ask you to do so, just don't tell your oncologist. He'll have a fit. Then there's this thing called geopathic stress. The book, Are You Sleeping in a Safe Place by Ralph Gordon, explains it all. I'm not going to explain that all to you, but find out for yourselves, because it is so important. Heavy metals like mercury, cadmium, lead, aluminium squander vitamin C, selenium, and zinc. They also suppress your immune system. If you have a fungus, it can be difficult to eradicate while you keep swallowing mercury. How many people here have got mercury fillings in their teeth? Many. I had 16 teeth with mercury fillings in them. I had every one of them removed years and years ago when I discovered this is important. You are swallowing mercury all the time. And if you're doing that, it is very difficult to get rid of the fungi. Finally, stress is so important, it underlines all that goes wrong. So think logically. Think about the possible causes, the things you've done wrong in life. One treatment for prostate cancer is chemical castration. They cut down your levels of testosterone. A drug that reduces your level of testosterone is given by injection most of the time. If testosterone is the big baddie, why do men develop cancer in their prostate when their levels of testosterone are presumably falling? Why doesn't your 20-year-old Randy Buck get prostate cancer? There's something wrong with the theory. When they took prostate cancer cells in a laboratory, they found that one of the best ways of killing them was with testosterone. But it's not the testosterone that's causing the problems. It's the converting into dihydrotestosterone. That's what makes most of us men lose our hair. It's the dihydrotestosterone, not the testosterone itself. So why do we convert too much of our testosterone into dihydrotestosterone? It's estrogen. Estrogen is a big baddie. Estrogen is produced by the fat of your body in men and women. I spent some of the winter in the West Indies, and I see big fat blokes walking along the beach like this, and that must be causing terrible problems with their backs. And yet the estrogen in men as well as in women is produced by the fat of the body. And they have no idea about this at all. So why does estrogen promote cancer? It causes testosterone to be converted into dihydrotestosterone, as I've already told you. It causes intracellular hypoxia, low levels of intracellular oxygen. It causes retention of copper and loss of zinc. And copper is not so important, but zinc is. And what symptoms do women suffer from who develop breast cancer? Premenstrual breast symptoms. So premenstrual breast symptoms are a precursor to breast cancer. So you just got to get rid of it. You just change your diet and things work. Lymphoma. Lots and lots of people develop lymphomas. What are lymph glands for goodness sake? Infections. They deal with infections. So why do they give you chemotherapy if you have a lymphoma? Why don't they deal with the infections? Because it just simply means that your immune system has been insufficient to deal with the infection that you have. If a child bleeds into a joint with leukemia, what does that suggest to people? An acute vitamin C deficiency. Every child with leukemia should be immediately put on vitamin C and not chemotherapy. And I'll bet you anything that would work. So let's summarize why cancer develops. The diet contains animal milk, which is inflammatory. So that's from the beginning of life. But your body is a remarkably forgiving structure. Sugar is normal for most people in their diet. Most people eat rubbish. They don't eat nearly enough fruit and vegetables, so diminishing their nutrient intake, and their immune system is affected. And people pick up infections time and time again. Apart from their reaction to milk, with the tonsillitis and adenoids and possibly asthma, all sorts of little bits and pieces that people develop in life, they become infected, so they're prescribed an antibiotic. And there wasn't a single person in this room who has never had an antibiotic in my life. Every one of you has had antibiotics for something. And the antibiotics, and they develop a fungal infection, and they continue to eat sugar or eat more of it. They develop tooth decay, so they have mercury amalgam fillings put in. People have been told they're silver amalgam. They're not silver, they're mercury, 50% mercury. And that squanders vitamin C, selenium, and zinc, and that affects their immune system further. And apparently not in Sweden. The seeds of cancer tumor are laid down. More infections, more antibiotics, more fungal infections. Cigarettes and alcohol are added to the load. These produce huge numbers of free radicals, which your body has great difficulty in dealing with. And think of the myriad chemicals we're all exposed to in life. The chemicals in the carpets, the plasticizers, the petrochemicals. Many strip your body of essential nutrients. They are certainly inflammatory, and some may even be directly carcinogenic. That means produce cancer. But you don't increase your antioxidant intake when you're exposed to them. It doesn't even occur to you to consider doing so. If you're a woman, your diet may allow you to develop premenstrual symptoms. You therefore have a hormonal imbalance with too much estrogen and not enough progesterone. That predisposes you to breast cancer. If you're a man, too much estrogen predisposes you to prostate cancer. Lots and lots of women have HRT, or the contraceptive pill. So it gets into the water tables, and we're all exposed to small amounts of it. Then, as I've already said, the xenoestrogens, they are the chemicals in your plasticizers, your petrochemicals, etc. We're exposed to estrogen in our lives all the time. And you may become vitamin D deficient because vitamin D is anti-inflammatory. I take a minimum of 4,000 international units of vitamin D daily when I'm not in the sunshine. And because of a poor immune system, you may pick up various infections, some of which may directly promote cancer. So surely that's what a lymphoma is all about. It's about an infection your immune system has been unable to deal with. So why give chemotherapy for a lymphoma? You may live in a mouldy house or be exposed to geopathic stress. Remember, excess estrogen and alcohol create free iron, which your cancer cells feed on. Most of the bad things in life create acidity and produce free radicals. Do you have enough antioxidants to deal with those free radicals? When you've had the chemotherapy and radiotherapy, do they give you any antioxidants to deal with those that you've absorbed to stop you developing cancer later on in life? No, they don't think about that. And remember, cancer cells thrive in an acid environment. Cancer cells do well in a comparatively low oxygen environment, which is more likely to be the case in an acidic environment. We tend to eat a diet lacking in digestive enzymes, so cannot stop a tumor enclosing itself in a mucous protein coating. Then the big stress hits us, and we've had it. Our immune system takes a big tumble. Cancer, which has been growing slowly, then declares itself. So don't think it's suddenly developed. It's been growing slowly for years. I'm producing cancer cells every second of my life, but my immune system, I hope, is dealing with them. So how do we deal with cancer? It's all there. You simply undo all the things that you've been doing wrong. There's a long list of the problems. Poor diet, sugar, individual foods, alcohol, diet drinks, aspartame, dairy products, caffeine. The whole list there of all the things that you need to consider. You may or may not there. It's all in my book if you want a copy of it later on. It's all there. But simply start by changing your eating habits. That's what you've got to start doing. Start by avoiding all animal milks, and products, all beef, all sugar, all white refined flour products, all caffeine, all alcohol. And caffeine, don't forget, is in chocolate. It's also in cola drinks and things of that sort. I don't know whether many of you have heard of Juice Plus. It's fruits, vegetables, berries and grapes, 26 of them in a capsule with all the water, the sugar, the salt and the fibre removed. And I'll talk to anybody afterwards who might be interested in that. But there are 36 double-blind, placebo-controlled studies that tell you what Juice Plus does to your body. And taking the Juice Plus means you significantly increase your fruit and vegetable intake. I've been on them for 15 years. So is my wife. So are my sons. We're all taking them because we are aware of how much good they take for us. Because of your poor diet, you do not have enough digestive enzymes to prevent the coat from the protein coating from forming and break down. You need to take large doses of digestive enzymes to do the job for you. And Juice Plus contains active digestive enzymes, so again, is very valuable. Live enzymes come from cooked food. If you cook the food, you damage the enzymes. You will need something to boost your immune system. Everybody with cancer needs that, but nobody takes any notice of that. I used to recommend BioBran, and it can be prescribed on the NHS if your GP is prepared to do so. The chances are he will say, oh, I've never heard of that, but it is possible. And the people who make BioBran will give information for you so that you can get hold of it if necessary. You will need large doses of antioxidants, vitamin C, selenium, alpha-lipoic acid. Those are just 3 of many, many antioxidants that are available in life. And of course, there are plenty in fruits and vegetables. You will need something to clear infections from your body. Colloidal silver, iodine, chlorine dioxide. Chlorine dioxide is absolutely wonderful. It's like hydrogen peroxide. I used to give big doses of hydrogen peroxide intravenously to cancer patients with a really very, very beneficial effect. But you don't need to have it intravenously. You can take chlorine dioxide yourself. And you will need to deal with geopathic stress if you discover it's causing your problems. You will need something to take to make your body become more alkaline. So start simply with old-fashioned sodium bicarbonate and consider a proprietary preparation. Just take sodium bicarbonate, half a teaspoonful, in plenty of water, 20 minutes to 30 minutes after a meal. You will most certainly need to resolve all stress and heal the physiologic effect they have upon you, because they really do. You need to be aware of that. If you have a genetic predisposition, all you have to do is work harder. That's all you have to do. How do you antagonize or balance estrogen? Start by changing your dietary habits. Lose weight, bioidentical progesterone cream, perhaps. Antagonize conversion of testosterone into dihydrotestosterone with various different herbs. They're all available. But start off just by changing your diet. You'll be surprised how many people will find an improvement. Iodine can be very, very important if you've been exposed to radiation. Yes, radiotherapy will cause that, but a lot of people develop cancer because they're exposed to radiation from Chernobyl and things of that sort. You don't need to take an awful lot, just 1 or 2 drops of Lugol's iodine a day, morning and evening, and that will be all you need. And it will also help your thyroid gland, because most people with cancer, their thyroid gland does not function properly. But that is a big subject in its own right, so just take small doses of it. I never tell anybody not to have chemotherapy or radiotherapy. That's not my job. People have to decide for themselves whether they're going to do that. That is entirely up to them. And if you have chemotherapy or radiotherapy, please, please take the big doses, the antioxidants. And if you can find somebody to give it to you intravenously before and after the chemotherapy, do so. If you have radiotherapy, take homeopathic or Rad Brom 30C 3 times a day while having it, or for at least 2 weeks after the course has ended. Try to organize your radiotherapy in the morning so that you can slap on aloe vera gel every hour through the rest of the day before you go to bed. And for 1 week afterwards, it really does help the inflammation in your skin. It doesn't help the tissues underneath, but it'll at least stop the skin from burning. If you have chemotherapy, take a homeopathic dose of the drug. Find out the name of the drug itself and take a homeopathic dose of potency of 30C 3 times a day for at least 1 week after the course has ended. With chemotherapy in particular, please take probiotics. Apparently we're not allowed to call them probiotics any longer, according to the EEC. Aren't they stupid? take probiotics, I'm going to say so, on a regular basis as chemotherapy kills the friendly organisms in your bowel. That's if you've got any left from all the antibiotics you've had. With both, improve your immune system, please, and alkalinize yourself. Learn relaxation, visualization, and affirmation exercises. They don't cost you a penny. They are so effective. So many people told me when they had cancer that affirmation exercises were some of the best things I ever taught them. And they're all explained in great detail in the books that I've written. Now, I'm just going to finish off with something called the ketogenic diet, the big K. Cancer cells feed on sugar. I've explained that, and that's absolutely sure about it. It's a very difficult diet, but if you do it properly, it will kill off all cancer cells in 2 to 3 months. And that's quite something to say, but it's not easy to do. And there are lots of pitfalls people fall into. But you have to cut out carbohydrate and eat fat and protein. In 36 hours, once you do that, you will use up all sugar reserves in your body and you will start to produce ketones. Most doctors say you don't want ketones. That's what diabetics suffer from. This is different entirely. This is not ketoacidosis for a diabetic. This is ketosis because your body's working on producing the ketones because there's no sugar. Your cancer cells will start to die in 36 hours. You can even start off with a fast of 24 or 48 hours if necessary, or a 5-day fast. And I talk about the 5-day fast in this book here, Conquering Cystitis. So what do you have to avoid? I've not put this in my book because it's so complicated, but if anybody wants a copy of the ketogenic diet that I recommend, then I will happily send you an email. You'll have to send me an email and I'll do it. So this is just an alphabetical order of all the foods. And you'll notice that all the grains, the processed foods, potatoes, red meat, rice, wheat at the bottom, the whole lot, they're big, big requirements. What you may eat, again in alphabetical order, are a whole list of very interesting foods. There are a lot of foods there you can eat, but they really make a huge difference. All nuts, olives, etc. But each individual person needs to identify what their particular foods are that are causing their problems. I have a patient with a terrible facial cancer who's a diabetic. Of course, diabetics produce sugar. You've got to bring your sugar levels down to 4. Otherwise, you won't produce the ketones. So it's very difficult indeed. You've got to stay on the diet for 3, possibly 4 months. And there's another list of turkey vegetables, all sorts of other things. But you have to find out for yourself whether you are producing ketones or not. So you need to test for yourself all the time. And this gentleman had levels of sugar that were too high. And I said, what are you doing? And he found 3 of the drugs he was on had sugar in them. So he needed to stop them. And some people have certain foods which individually cause their blood sugar levels to rise high. And other people find that they're not. I had a diabetic patient who was a husband of one of my secretaries. And he found when he tested that wholemeal bread produced a far bigger spike of sugar than sugar itself or white bread. Don't ask me why. I gave a lecture to some diabetics in Barbados a few years ago. And at the end I said, does anybody recognize what I'm saying? And one woman said, yes, rice makes my blood sugar go up. Yes, pumpkin makes my blood sugar go up. I said, you're still eating them? Yes. Why? Well, we like them. It had never occurred to them that if they were to stop the things that make their blood sugar go up, they might not be diabetics. So people have to identify the foods. And I've got one patient who finds that certain nuts make his blood sugar go up and certain other nuts don't. So you have to identify for yourself. So stop worrying about cancer. Everybody worries about it. It's been there for possibly 15 years. It's going to be there tomorrow. Start thinking about what you can do to help yourselves. Become positive. Believe you can overcome your cancer, because you jolly well can. Thank you for listening. Three-quarters of an hour. That's not bad. Yes, questions may be asked, so long as I can hear them.
It's about sunlight in the northern hemisphere. Can you get sufficient vitamin D in a young person's body at a certain time of the day, at a certain time of the year?
Vitamin D, it's very difficult. It's very difficult. So personally, I think you just need to take supplements in this country, because we're not in California, we're not exposed to the sun all the time.
Do you have any experience of the new Candida killer that's all over the internet that's based on leuphoneuron?
Well, I'm not going to specify. I just specified 3 anti-Candida approaches. You find the things that suit you and you want to try. I'm not going to suggest for 1 minute there's one particular product.
Yeah, I just wondered if anyone...
No, I'm sorry, I can't answer the question.
Why would you say a few more words about chlorine dioxide as opposed to hydrogen peroxide and ozone?
Chlorine dioxide, okay. Chlorine dioxide is just like hydrogen peroxide. And basically, you can get it by ringing up 01509 880 447. 01509 880 447. Be patient, because I have a suspicion, and a lot of you are going to ring him and ask for it. It's very inexpensive, and he will send you instructions as to how to take it, and it really does work. But I would suggest you don't take more than 12 drops in the little bottle, and you'll understand exactly what I mean by that when you receive the instructions. 12 drops is enough for anybody.
I'd like to ask how and where you can get the ketones tested.
Sorry?
How you test and where you get your test ketones.
You get the ketone sticks from the chemist and you measure them in the urine.
Oh, right. So anyone can get those. You can recommend those to
and you
clients.
need to get a proper blood sugar measuring testing kit like diabetics use. So you have to prick your finger and you have to measure your urine, yes.
But you get your clients to get the ketones tested.
You will produce ketones if you bring your sugar levels down to 4, yes.
Right. Okay. Thank you.
Is that it? But I've got till past, haven't I?
No, the next session starts at 1:30.
Oh, I'm afraid the next session starts at past. I will be outside to talk to anybody who wants to talk to me.